Welcome back to aRDists Podcast. Get ready to hate me. So I had an initial thought about this episode of kind of talking about nutrition expertise, since I am also a dietitian, hence the dietitian shirt today if you're watching. But I have been a little bit slow on kind of watching. When it comes to politics, it's like watching that episode of The Office where Michael Scott had promised, you know, if you know the Scott's Tots episode, it's so hard to watch. If you haven't seen The Office, essentially Michael had promised a bunch of like first grade students that he would pay for their education when they graduated high school. Basically pay for their college, because he, in his mind, was delusional in thinking that he would be a millionaire and would have the ability to fund all of these kids' education. And then he needed to go to the school and tell them that he couldn't actually fund it. And they had like a whole like song and whatever to like celebrate him and thank him. And it turns out he could only offer them laptop batteries. It's such a hard episode to watch. But my point is, the difficulty in watching that episode is like watching political speeches of any kind. I have been watching, and I'm only about halfway through the 3.5 hour, however long, roundtable from like 8 months ago. At least I think it's from 8 months ago. That's when it was uploaded, of RFK talking about like health and nutrition and stuff. And obviously it's been more recent in the news of him mentioning threatening to take away funding from medical schools if they don't offer nutrition education. And obviously there's lots of opinions on implementing that sort of a thing. And so I thought in this episode I could touch on that a little bit, just coming from a dietitian's perspective, what I think about that. And yeah, I'm scared. So I wanted to, before I dive into that and completely lose all my followers, just talk a little bit about like the education that dietitians are required. I was going to draw while I did this, but I feel like it requires too much of my attention. So I think I'll talk now, and then if I want to have some illustration over top of it, I'll do that as well, or I'll just doodle. I don't know. This episode is exhausting already, and I haven't even started it. A lot of people are like influencers, a lot of people taking up space on social media, kind of giving their health and nutrition advice and showing people like what I eat in a day, making suggestions to people, or just sharing what they do, or promoting a specific diet plan, like, carnivore, keto, plant-based, vegan, whatever it might be. And the great thing about food and nutrition as a topic is that there's really a low barrier of entry. Like, we can all talk about food, we can all talk about nutrition because we all eat. So it's easy. It's an easy conversation piece. There's like cultural aspects of food. There's, complaining about the price of food, sharing new recipes. It's a really, conversation starter. But at the same time, understanding like where, like disseminating the correct information from opinion, or understanding the lack of scientific research. So as a dietitian, we focus on evidence-based nutrition practices. So we're not going to promote a nutrition we're not going to have nutrition recommendations based off anecdotal evidence. We need actual scientific research in order to make recommendations. And I think one of the main things that I agree with from the roundtable is funding more, nutrition research, and generally just funding more nutrition science research. And I feel like there's a general misunderstanding or lack of understanding of what dietitians are I know that there are a lot of dietitians out here who have, presented like, this is what we do. This is, the difference between a dietitian and a nutritionist. And I feel like that's been said over and over again, but for whatever reason, it's still not like mainstream as much as it could be. So I'm just putting my voice out there. I'm contributing. I wanted to kind of walk you through my undergraduate curriculum. So all the classes that I took, and kind of give you a better picture of what nutrition experts look like in the context of like what kind of background and education we as dietitians have, and how much extra of a burden that would be to require as much or like comparable education for doctors, as RFK would prefer, I guess, that doctors take on more of a nutrition education. But just to kind of give you some context, for my particular undergraduate degree, I went to school at Oregon State University, and my course list is as follows. Actually, so I will say one caveat. This is off of the website, and I don't know if there's been any subtle fluctuations in the course curriculum. I don't remember if I took Principles of Biology or just Intro to Biology. So I don't know if it's the same course, just a slightly different name. Anyway, this is what's on their website now. For the most part, it's pretty much identical. Okay, Principles of Biology, the general chemistry sequence. So that was 1, 2, 3 terms of general chemistry classes along with their accompanying labs. And then organic chemistry. I took two terms of organic chemistry, course on social determinants of health, which I'm going to get into that a little bit more a little bit later. Intro to microbiology, orientation to the nutrition major, course on food and culture, human nutrition, applied food and nutrition, nutrition across the lifespan. So we studied from, like pregnancy all the way through old age. Introduction to psychology, and a writing course. And that was like the first pre-dietetics option. And then once I got into the dietetics option, these are the courses that I needed to take. So this next set of courses are kind of like the main dietetics course. So there was a business course in managing organizations, elementary biochemistry, introduction to human anatomy and physiology, and that was over the course of 3 terms. There was the anatomy and physiology lectures along with their accompanying, what do they call them? Seminars and labs. So that was probably my favorite sequence of all of them. Terrifying at first because we had human cadavers, which I was a little intimidated by being around dead bodies, but it was actually really fun. Educational. I don't mean like we were like playing with the dead bodies, but like fun in the sense of like, oh wow, this is a great learning experience. Anyway, tangent. There was the second course of organic chemistry, communication course. I took argument and critical discourse, but other options are public speaking or interpersonal communication. Public health, equity, and social justice in the U.S. I think that was a slightly different course when I took it. Exercise physiology, science of foods, food service production and purchasing, nutrition and social marketing, preparing for careers in nutrition, seminar course, nutrition science macronutrients, as well as nutrition science micronutrients, community nutrition, and then 3 terms of medical nutrition therapy, course on communications in dietetics, managing food and nutrition services, management of food systems laboratory, and then introduction to statistical methods. So that was my 4 years of undergraduate education. So I wanted to kind of walk you through all of the different elements of, my nutrition education. So obviously we took a ton of chemistry, different biology classes, as well as, exercise physiology, the science of foods, cooking classes, medical nutrition therapy, so implementing it in the context of like different disease states. And this is just the undergraduate degree. So those are all the courses that we take. And then in order to become a dietitian, we have an internship, and it's 1,200 hours typically of supervised practice. The exception, and why I say typically, is because during the COVID pandemic, there was an exception because everyone was sent home, and not all of the education could be done in person, and so they allowed some accommodation with the total number of hours. But it's usually 1,200 hours of supervised practice. So you're in hospitals, in community centers, in like WIC offices, primary care settings, and providing nutrition education to people of all shapes, sizes, disease states, ages, cultural backgrounds, and kind of getting that practical introduction to working with people and taking all your education and putting it into practice. And then after we complete our internship, we take an exam, like a standardized exam, just to ensure that we are, understood enough and could apply it. That is the summarized version of kind of everything that we go through in order to, become part of the healthcare team. So when somebody takes basic nutrition course on macronutrients and micronutrients, and then starts offering advice online or selling programs and things like that, it's a little upsetting, obviously, to dietitians that like we went through all this education and then these people are making tons of money selling snake oil. Not having the full understanding of the people that they're selling these things to. So I just want to kind of give you an example. So let's say a person books a 12-week program with a dietitian such as myself, and I see them every week for an hour for 12 weeks. And I take them from kind of like the basics of macronutrients and nutrient metabolism, and I get to know them and give them specific recommendations, and we work through like struggles and things to like, obstacles, and utilizing things in their network and in their community and things like that. And they leave with that education and how to implement it in their life. Now, do you feel that they leave as a nutrition expert, that they can go give advice to, people in their life? So the obvious answer is no. The advice that was given was applicable to that person. I'll hear the information and kind of assess the appropriate recommendations based on their situation. Let's just say that patient was like struggling with an eating disorder, and they had type 1 diabetes and some depression, and so they would not be qualified to do a thorough assessment of someone in their life who, let's say, has also depression, but they have type 2 diabetes and are like dealing with obesity. So our training and education offers us exposure to a wide array of disease states to be able to ask the right questions and gather the right information and assess, which areas are most acute, so most urgent, and make recommendations to best support the client's health in that moment. And kind of understanding that might vary. There's going to be fluctuations, and other circumstances, variables can play a very critical role in a person's health, and goalposts might move as you work with someone. And so kind of along those lines, I wanted to talk about social determinants of health. So if you're not familiar with social determinants of health, it's, you're taking into account the multitude of variables that play a role in a person's health and their status right now while they're in front of you. So in sessions, I'm most likely going to dig and do a bit of I always tell them, I'm like, this first session is usually a deep dive into your health history and getting to know your health habits and eating habits and all these sorts of things. So social determinants of health, things like economic stability. This is going to cover things like their current employment, their income, expenses, their debt, their medical bills, their support. I'm not necessarily going to ask about all of these things. They might come up in relevance to, being able to determine whether they're dealing with food insecurity and, are they going through unemployment right now? Do we need to spend some time talking through, like what food banks are in the area, or apply for SNAP benefits, or, taking into account what their financial status is and economic stability. If somebody just recently lost their job, it's good to take into account their financials, because if I make recommendations to, eat a certain way and it's just not affordable, then I'm not doing my job. Other social determinant of health, physical environment, and neighborhood. So this comes up a lot. So taking into account their housing situation, transportation systems near them or transportation options, the safety of their neighborhood and physical environment, different parks nearby, playgrounds, how walkable their neighborhood is. And this might seem like, why the hell are dietitians talking about this? But when it comes to housing, for example, I've had patients who don't live in a home, or were recently homeless and have some fear about that happening again. I need to take into account what kind of cooking implements and appliances they have available. If I say, oh, why don't you just do one pan meals so that way you don't have to cook? And they're like, I don't have a functioning oven. It's good to know, what are we working with? If we're talking about going to the grocery store once a week, do we need to plan for once a month because they don't have a car, or they can't afford the bus, or they live too far away and gas is expensive? These are all factors to take into account with our sessions. Next, social determinant of health. Education. What is their education level, literacy level? What is their primary language that they speak? If they have, higher education, kind of like, what is their education level? What do we need to, focus on? When I think of, like literacy, I think, what's your level of understanding of the like nutrition label, or nutrition, the nutrition facts label? What do we need to talk through with that, or understanding portion sizes, serving sizes, simple like addition, subtraction, multiplication, depending on like what the package reads. Is this, if it's a 5-ounce package and 1 ounce is a serving, then we need to do, and you eat the whole package, then we need to multiply everything by 5, and kind of understanding that. Having some food literacy is also important. Other things related to food, again, like food security in general. Do we need to talk through like community resources, food banks, what stores are nearby, create a plan for, creating a shopping list even. What is their access to healthy options? Like, is the closest store nearby a, convenience store, and what's available in that store? And then other things related to like food literacy is cooking skills, shopping skills, knowledge of the components and qualities of different food items and how they're going to cook, how you prepare them, things like that. Another social determinant of health is a person's healthcare coverage, provider availability near them, depending on how, close they are. They might be really far away. They might be living in a rural area, far away from, like a city where their primary care provider is located. And that can determine whether or not how engaged they are in the healthcare system overall. And they might just opt not to go, and then things get, not taken care of urgently enough. And then, of course, in relation to dietetics, does their healthcare coverage cover the cost of a dietitian? Are they even able to speak with someone like me? If we want to improve upon a current healthcare system and focus more on preventative medicine, insurance should reimburse more for visiting a dietitian, in my opinion. Let's see. And then the last social determinant of health I wanted to cover, community and social context. So what is their kind of social circle? Do they have support systems from family, friends, facilities in the area? Are they engaged in the community, or are they fairly isolated? All of those can definitely play a role in a person's overall health. Have they experienced discrimination? Are they integrated well into, social circles? So again, social determinants of health, we've got community and social context, food, healthcare system, education, physical environment and neighborhood, and economic stability. And I kind of went through some of those and how they relate to dietetics and my conversations with patients. Anytime I've visited the doctor, I haven't had a long time to talk through this, but being able to see a dietitian, weekly or bi-weekly or once a month, just to kind of have check-ins and make progress on habit change and things like that. If health changes were as easy as, Nike's logo of just do it, then everyone would just be getting it done. But having that additional support from a dietitian is, I feel like, really helpful. Dietitians are here. They're already trained. They're already taking action on improving, community health. And I'm not sure if RFK is just, unaware of the existence of dietitians, but I think forcing doctors to take on more education and training when the dietetics profession already exists to kind of fill this gap as part of the healthcare team, it doesn't seem like the solution, to force more nutrition education on doctors. I do support the idea that doctors should have nutrition education, but removing funding from their schools and, what is your expectation with nutrition education? What do you need doctors to do that we can't do as dietitians? We're here, we're trained, use us. It just seems like another burden to put on doctors, another, layer of training and education. If doctors want to go into nutrition a little bit more deeply rather than, and do more of the preventative medicine type thing, doing more of that post-grad, I think, is kind of up to them. But like I said, I feel like health insurance should cover visits with a dietitian, get that more, emphasize that a little bit more. I think dietitians should be utilized more, lean on our expertise, fund more research for our field, and improve referral processes, kind of get more people to know that I want more people to know what our role is and what our sessions look like, understand why we're here and how we're, putting our education into practice. And it is really hard when there are, like I said in the beginning, influencers that have their sort of anecdotal evidence or very convincing style to encourage people without the understanding of the harm that they could be doing. So like I said, if someone gets counseling from me for 12 weeks, they're not educated enough to go and make the determination whether the health information that they were taught is appropriate for someone else, if that makes sense. So let's just say there's an influencer named Chickadoo. I don't know. I don't want to use somebody's actual name because I don't want to call anyone out. Chickadoo is saying keto diet or carnivore. Let's say carnivore diet because let's ruffle some feathers. And they're recommending carnivore diet. Someone might hear that and think, oh, I want to try that. And the problem is that it might not be appropriate for them. And I don't know how else to explain that. To make a nutrition recommendation that this is such a great diet or that this worked so well for me, I understand they put in that caveat, obviously talk to a doctor, talk to whatever, talk to a dietitian. Hopefully they say talk to a dietitian before starting this. But that's the problem, is that it's being presented as like so convincing, and then also just throwing in that little like don't sue me spiel. Like, it just seems shady. My point is, who else is trained to take into consideration all these factors, variables, medical conditions, and boil it down to what foods to eat, how to prepare them, which ones to focus on, which ones to increase or decrease, make determinations of when to make adjustments, and working with, again, those social determinants of health. If it's appropriate for someone to, we'll say, increase their fiber intake, and they don't live close to a grocery store that has fresh produce, we can talk through options that are available. So frozen produce, canned produce, frozen, like frozen fruits, ways to incorporate it, like fun ideas. Like I have frozen mango and strawberries in, if you don't like fizzy water, just plain water. So increasing fiber in those ways, like things that are more accessible. I just think there are a lot of people who don't understand the social determinants of health and what that looks like in a person and how that might influence their nutrition, and how shaming them for their food choices is also not healthful. Like I said, if it was easy as Nike's logo of just do it, we'd all be doing it, but it's not. Some people live too far away from a grocery store. I had one patient who experienced seizures, and then they weren't able to drive for 6 months. So there are things that come up that you need to adapt to. There are, people who are caring for a loved one and they're in the hospital for hours or days or weeks on end, and they need to, cope with stress and, manage their hunger with what food is available to them. Sometimes they indulge in more comfort foods because that's what they need in that moment. I'm not saying, I don't have answers. I just ask for more like empathy, sympathy, and, for our fellow humans that might not be doing what you think is right, because they're doing the best they can. But yeah, more empathy, more sympathy, and utilize people who are already doing this work that you want. Dear RFK, pull your head out of your ass and realize the dietitians exist. We are here doing the work, and if we had more insurance reimbursement and more people knew about us, then perhaps we would make more. Maybe we can make more of an impact on, chronic disease prevention and managing chronic disease, and also fund more research so we have evidence to support nutrition claims. Anyway, that's all I got. Hope you enjoyed this episode, and leave your comments down below. Feel free to not leave anything negative, because I will delete it. Subscribe. I'll see you in the next one. Bye. Thanks for listening to aRDists Podcast. If you liked this episode, share it with a fellow creative goblin and hit subscribe so you don't miss the next one. Now go make some shit, and I'll see you next time.